All right. Good morning, everybody. Today's topic we're going to be discussing is going to be hospice and home health care benefits. Let me go ahead and get started. So for everyone who is not aware, home health care services, you need to have Medicare Parts A and or Part B to cover eligible home health care services. Things like part-time or intermediate skilled nursing care, physical therapy, occupational therapy, speech language pathology services, and medical social services, part-time or intermediate home health care aid services, which is personal hands-on care, or injectable osteoporosis drugs for women. We will go over in what situations Medicare Part A would cover home health care and in what situations Medicare Part B would cover that a little bit later on here. Usually a home health care agency coordinates the services your doctor orders for you in terms of these home health care services. So essentially what happens is that one of these home health care agencies would contact you. They would get you connected with a agent who would come out and coordinate your care out there. They would also set up your schedule for what would happen while they're out there. What Medicare will not pay for in terms of home health care services are 24-hour-a-day care at home, meals being delivered to your home, homemaker services like shopping, cleaning, and laundry. Please, everybody please remember to mute your microphones if you're on here. Again, homemaker services like shopping. Hang on one second, everybody. Okay, maybe that got stopped. Nope, doesn't sound like it. Again, if everybody would please remember to mute your microphones when you get on. Okay, homemaker services like shopping, cleaning, and laundry, when this is the only care you need. Custodial or personal care like bathing, dressing, or using the bathroom when this is the only care you need. Things like all of these, the 24-hour care at home, meals, homemaker services, and custodial personal care really are not the responsibility of home health care services. There are programs that would pay for one or more of these. The one that really comes to mind from TennCare would be the Choices program. That would be a program that people who qualify for care in a nursing home but would like to remain at home can qualify for, and they would provide a lot of these services like homemaker services, personal care. Okay, I thought I heard somebody talking. Maybe not, though. Anyway, the Choices program would cover a lot of things like this. But there are also other programs where you could just qualify for Meals on Wheels or things like that. And then for 24-hour-a-day care at home, you would probably have to hire somebody to coordinate that. Who is eligible for home health care? That would be all people with Part A and or B who meet 5 specific conditions. What these 5 conditions are, the first one is that person must be homebound. Now, the new definition of homebound has been clarified to more accurately reflect the definition in Section 1835A of the Social Security Act. This would mean that you have trouble leaving your home without the help, like using a cane, wheelchair, walker, or crutches, or special transportation with the help of another person. Because of an illness or injury, leaving your home isn't recommended because of your condition. You're normally unable to leave your home, but if you do, it requires a major effort. I think that part is probably the one that most people should take as sort of their little snippet as what homebound means. Normally unable to leave your home, but if you do, it requires a major effort. You may leave your home for medical treatment or short, infrequent absences for non-medical reasons, like an occasional trip to the barber, a walk around the block or a drive, or attendance at a family reunion, funeral, graduation, or any other infrequent or unique event. And you can still get home health care if you attend an adult daycare or religious services. So essentially, just to really wrap it up, it would be you're normally unable to leave your home, but if you do, it requires a major effort, and you're not leaving your home with the exception of some sort of specific special event. You're not, going every day and taking a trip to the library or to spend some time out someplace. You're going for a special event or something that is required of you, or something that somebody would hold especially dear, like a religious service. That's the first of 5 conditions. Please, everybody, do remember to mute your microphone if you are on here. I'm getting, some feedback here. Condition number 2 would be that you must need skilled care on a part-time or intermediate basis. That would be determined by your doctor at that point. Which brings us to number 3, you must be under the care of a doctor. And that would mean that you must be receiving services under a plan of care. So when you go and meet with your doctor would draw up a plan of care based on what your needs are. And that doctor would then in turn give that plan of care over to your home health care agency, and they would help carry out that plan of care that your doctor had put in place. You must have face-to-face encounters with a doctor prior to your start of home health care. So you can't just set all of that up over the phone. You would have to have a face-to-face with doctor. Now, I do believe that something like a telehealth where you are video chatting your doctor would also serve as that face-to-face. But that would be something that would be a special exception, that you're still getting a face-to-face, even if it is through a phone. But in most cases, you are going to be needing to go and be in person with your doctor prior to that being started. The 5th one is probably the most obvious, that being that the home health care agency must be Medicare approved for a person to get home health care through that agency. It's just like anything else. If you must go see a doctor who accepts Medicare or go to a hospital that accepts Medicare, you must have a home health care agency that does accept Medicare in order to get Medicare approved through that agency. You would think that would be kind of a given, but we do find from time to time that people do not make sure that whom they're calling is Medicare approved. Now, paying for home health care. The good news in terms of home health care is that home health care is fully covered by Medicare. Medicare will pay for home health care 100%. Your plan of care is reviewed every 60 days. That is called an episode of care. Give whoever just logged on the chance to mute their phone. Okay. That plan of care is reviewed every 60 days. Like I said, that is your episode of care. Please do remember to mute your phone when you log on. Hang on, everybody. I'll make sure that gets muted before I continue. That would be call-in user 14. If that's you, that would be your phone that was making all that noise. In original Medicare, you pay nothing for your covered home health care services. You would pay 20% of the Medicare approved amount for durable medical equipment, which is covered by Part B. Now, in what situations will Part A cover home health care, and what situations will Part B cover home health care? Now, while home health care is normally covered by Part B, Part A provides coverage in certain circumstances after you're in a hospital or skilled nursing facility. Specifically, if you spend at least 3 consecutive days as a hospital inpatient or have a Medicare covered skilled nursing facility stay, Part A covers your first 100 days of home health care. You still must meet other home health care eligibility requirements, such as being homebound and needing skilled care. You also must receive home health care services within 14 days of your hospital or skilled nursing facility discharge to be covered under Part A. Any additional days past 100 are covered by Part B. Regardless of whether your care is covered by Part A or Part B, Medicare pays the full cost. People may ask, why is it important to understand that difference and when Part A or Part B is going to cover that service? If all of those costs are going to be covered fully, if anything is to ever go wrong and there's any sort of billing issue or anything like that, it is important to understand when you're being billed under Part A or being billed under Part B when you're filing, appeals. So while you may say, okay, I don't have to focus on that as strenuously as I do on something else, it is important to make sure that you are understanding how you're being charged for your care, because if anything goes wrong, and I'm sure anybody who's a coordinator who's taking these calls every day, or any of the volunteers that are taking calls every day, know very well we do tend to speak to the people that it goes wrong for the most. So please do be prepared, and for your own knowledge and for anybody that you're assisting, these are the situations in which Part A would cover it and when Part B will cover it. Now, I'm going to pause right here. If there are any questions or anybody in the chat, Lonnie, I'll give everybody an opportunity to ask any questions in regards to home health care.
I'm not seeing any questions in the chat.
Okay, let me make sure if anybody's got their hand raised that I'm not ignoring them. Let's see. I'm not seeing any hand raised, but if anybody has a question, wants to comment that in the chat, then Lonnie, you can just interrupt me at any point while I'm going through all of this. Okay, hospice care. Hospice care would be different than home health care. Hospice care, if you have Part A and meet all of these conditions, you can get hospice care. Your hospice doctor and your regular doctor, if you have one, certify that you're terminally ill with a life expectancy of 6 months or less. So this is what hospice care is essentially for. It's for somebody who's been deemed to have 6 months or less of life expectancy left. If you accept palliative care for comfort instead of care to cure your illness, and you sign a statement choosing hospice care instead of other Medicare-covered benefits to treat your terminal illness and related conditions. Hospice is no longer for curing any sort of disease or condition. It is purely a comfort care at that point. You are trying to make somebody comfortable and easing pain management as opposed to treating symptoms and conditions. Hospice care is special care for terminally ill and family. That's something that a lot of people do leave out, is that there are a lot of benefits that your family can also receive from hospice care. You are expected to live 6 months or less. It is focused on comfort and pain relief, not a cure. And the doctor must certify each benefit period. Now, what this means is that once you are certified as, yes, you have 6 months or less to live, then the doctor will enter you into a benefit period. You start out with 2 90-day periods. So the doctor certifies you and says, yes, we have deemed that you have 6 months or less to live. Then that benefit period lasts for 90 days. After that 90 days is up, you would have another appointment with the doctor, and he would recertify you at that point into another benefit period if he still deems you had 6 months or less to live. Then you would enter into another benefit period, which would last 90 days. After that second benefit period, you go into a rotation of 60-day periods, unlimited. Each one of those appointments does have to be face-to-face. So you go through 2 90-day benefit periods, and then after that, you start getting recertified every 60 days at that point through a face-to-face encounter with your doctor. Now, we said this on the home health care benefits before as well, but that hospice provider must be Medicare approved for that hospice to pay what Medicare is supposed to, or for Medicare to pay what that hospice agency is providing. It is important, and you would think that it goes without saying, but again, you know, it's on these presentations for a reason. Now, what are the covered hospice services? Doctor services, nursing care, medical equipment like wheelchairs and walkers, medical supplies like bandages or catheters, prescription drugs for symptom control or pain relief. We will come back to prescription drugs here shortly. Hospice aid and homemaker services, physical therapy services, occupational therapy services, speech language pathology services, social work services, dietary counseling. That's an often forgotten thing that you can get, dietary counseling, grief and loss counseling for yourself and your family. Your family can receive counseling in terms of grief and loss, and then you can also be counseled. That is something that, you know, at least, you know, in my belief that people often forget, is that for the person who is passing away, coming to terms with one's own mortality can be, you know, just as difficult as your family's coming to terms with the loss of one's family member. Short-term inpatient care for pain and symptom management, short-term respite care, which we will also discuss a little further, and any other Medicare covered services needed to manage your pain and other symptoms related to your terminal illness and related conditions as recommended by your hospice team. So if your hospice team recommends it and it is a Medicare covered service in regards to the management of your pain or other symptoms, then that will be covered under hospice. Depending on your terminal illness and related conditions, the plan of care your hospice team creates can include any and or all of these services. So it can be, you know, as complex as everything on this list, or it could just be one or two of these things, depending on what your plan of care your hospice team create is. Paying for hospice care. Now, in original Medicare, you pay nothing for hospice care. You would pay up to $5 per prescription to manage pain and symptoms while you're at home. You may also pay up to 5% for inpatient respite care. So I had mentioned that, you know, in terms of prescriptions, you know, you may have a cost for your prescriptions when it comes to your pain and symptoms while you're at home. And then if for any reason you did have to be put as an inpatient for respite care, then you may be charged up to 5% for that. But aside from that, you should pay nothing for your hospice care. Excuse me, I'm sorry. Room and board may be covered in short-term respite care for pain or symptom management. If you have Medicaid and live in a nursing facility, room and board may be covered. But Medicare does not cover room and board when you get hospice care in your home or another facility where you live, like a nursing home. The exception to that, of course, is if you've got Medicaid, then Medicaid may pay for that. Medicare won't cover any of these once your hospice benefits start. Medicare will not cover any treatment intended to cure your terminal illness and or related conditions once your hospice has begun. Prescription drugs to cure your illness rather than for symptom control or pain relief. Care from any hospice provider that wasn't set up by the hospice medical team. Room and board, with the exception of if you've got Medicaid, then Medicaid would help pay for room and board. Medicare doesn't cover room and board if you get hospice care in your home or you live in a nursing home or hospice inpatient facility. If the hospice team determined that you would need short-term inpatient or respite care services that they arrange, Medicare will cover your stay in the facility. You may have to pay a small copay for the respite stay. Again, that's 5%. Care you get as a hospital outpatient, like in an emergency room, care you get as a hospital inpatient or ambulance transportation, unless it's either arranged by your hospice team or is unrelated to your terminal illness and related conditions. It is always a good idea to contact your hospice team before you get any of these services, or you may have to pay the entire cost. That is something that, you know, is not expressed, you know, as much as is that once you have accepted hospice, you are foregoing Medicare's coverage on all of these other things. Michael asked, with the respite care 5%, would your supplemental plan pay that? Yes. So care you get as a hospital outpatient, care you get as a hospital inpatient, or ambulance transportation, unless it's arranged by your hospice team, that's the one that I don't feel like a lot of people are aware of, is that once you've accepted hospice, you know, if you're getting care, you know, for your condition that's not been arranged, you know, that's going towards the treatment or cure of your disease or condition, Medicare is not going to cover that. And that is something important, that if something arises, unless it's unrelated to your illness or condition, obviously if it's for something aside from what you've been deemed, you know, 6 months or less to live, then Medicare would cover that. But if it's for your disease or condition that has got you qualified for hospice, they're not going to pay towards those at that point for treatment or care.
Ryan, I have an example of that.
Yeah, please, Lonnie, by all means.
I had a case where a gentleman, he was on hospice, but he actually fell and broke his hip. So, you know, there was some issues with Medicare paying because he didn't go through the hospice team. But with him falling and breaking his hip, that was something totally unrelated to his terminal illness. So we actually had to do an appeal and everything like that to get Medicare to pay for that because it had nothing to do with his terminal illness. That's just one example.
No, that's a great example. And I would honestly say that that example that Lonnie gave is probably going to be one of, if not the most common example of something that happens. To the same point that Lonnie was making is that for one person who was a family friend that I knew, that person had their arm broken during the transfer from one bed to another. They had, broken their arm, and they were put into the hospital and very clearly were able to get help paying for that, but it wasn't affiliated with what they had gotten onto hospice for. It is important to remember that only your hospice doctor and your regular doctor, if you have one, can certify that you're terminally ill and have a life expectancy of 6 months or less. After 6 months, you can continue to get hospice care as long as the hospice medical director or the hospice doctor recertifies at a face-to-face meeting that you're terminally ill. Now, I've put this on here because what this basically is saying is that only your doctor can certify that you're terminally ill and have a life expectancy of 6 months. You do have to go face-to-face and get recertified. That's, non-negotiable at that point. However, you can stay on hospice as long as they are recertifying that you've got 6 months or less to live. I say that because I have had experience with people being on hospice for an extremely long time. My family friend that I just gave the example about was on hospice for 11 years before they passed away. And they just kept recertifying. Yes, we still deem that you've got 6 months or less to live. They were on hospice for quite a long time. At that point, though, nobody's going to kick you off of hospice as long as that doctor keeps saying, yes, they have continued to hold on, but I still have deemed them with 6 months left to live, then you can remain on hospice at that point. Now, does anybody have any questions in regard to hospice coverage or any questions regarding home health care either? Lonnie, do we have any questions in the chat?
Yes, we do. Hang on. Okay, this one's a long one.
Okay.
Bear with me.
Okay.
Okay. What about a person who has terminal cancer but develops an infection and needs antibiotics? Would Medicare pay if this could be proven it is for comfort, fever reducing measures?
My immediate reaction was if they had gotten on hospice because they had cancer and they had developed an infection, that would not be treating cancer. That would be for the solution to the infection. So I would believe that Medicare would pay for that because it is not something that is directly towards treating that cancer. It is for fighting an infection to not make somebody additionally sick. My guess would be that Medicare would cover something like that and any treatment that would go along with fighting that infection. Lonnie, does that make
I concur because it's not
what you're understanding too?
Yeah, I concur. Whoop, am I muted? No, okay. Yes, I concur. Because that is not a condition that is related to their why they are on hospice. So Medicare should cover that.
Yeah.
And most
agreed,
of the time,
100%.
you can talk with the hospice team and they can go ahead and talk to the doctor, and the doctor can order the antibiotics. I mean, it's, it's either way. So, yes, Medicare should cover that.
Yeah.
Okay, here. Okay, I'm having trouble understanding the face-to-face with your doctor. If you are terminally ill and at home, seems difficult getting your loved one to the doctor.
That would be something that, yes, either you would have that scheduled with your loved one's doctor and would take them directly, or your hospice team would set up some sort of transport through your plan of care that would state that, okay, 90 days from now, we're going to pick this person up in some sort of transport, take them to the doctor for their, for their redetermination. And then if they got past both those 90 days, then they would just have that in the plan of care of every 60 days, they're going to need medical transportation to take them for a face-to-face visit with the doctor for a recertification into hospice. So it may not necessarily be that you have to transport your loved one. Typically, that is something that the hospice plan of care would also allow for, and they would have, some sort of, medical transportation. Or if the person said, yes, I'll take my loved one myself, then the hospice plan of care probably would make the exception for that.
Yeah, and there's some doctors that actually do home visits, or that's where telehealth can come in also. So,
yeah.
Okay, so let's see here. Yeah, some are saying some agencies have providers that will complete home visits for face-to-face requirement. So yes, there are doctors out there that will do home visits.
Yeah, absolutely. And it typically hospice care, people make a lot more exceptions for something like that in terms of doing a home visit or having somebody be picked up for medical transportation than it would normally be to schedule something like that on somebody who just was not on hospice.
Okay, any other questions?
No?
If you want to unmute yourself and ask a question, please do so.
If nobody has any more questions, I'm just gonna move on really quickly here before anybody can feel free to jump in and ask any questions that they would like to as well. But I did want to show everybody, I sent this out with all the materials yesterday, that we receive the Medicare and home health care official booklet each year. It's 32 pages. It does have who's eligible, what services are covered, how to find and compare home health care agencies, which we're gonna sort of just go through really quickly as well. And your Medicare right in that whole booklet there. I'm not going to sit and go through that booklet page by page because everybody has received that, and I feel like you all can navigate that yourself. But just to show a table of contents and finding and comparing all of these agencies, getting home health care, getting the help you need. Definitions are all through there, and you can scroll through and find, anything you need. The one thing I do want to make sure everybody understands too is that while there are a lot of, while we have gone through, all of how everything is laid out through Medicare A and B and what the costs and coverage are, please do understand that if somebody goes with a Medicare Advantage plan, that their cost and coverage prices may be different depending on the plan. It's always important to ask that. I would not believe them to be different. Most of the Advantage plans, at least that I've looked at, are pretty similar to Part A and B, but in the future, if anything were to change and those plans be restructured in any sort of way, that they would be subject to being within whatever the coverage options were for that Medicare Advantage plan too. Okay, so in terms of finding home health care agencies, what you can do is you can go to medicare.gov, scroll down to right below the picture. This changes, it seems like fairly regularly about where everything is located, but just look on this page and look for Find Care. And if you click that Find Care, it'll come up Find and Compare Doctors. And you can see right here, Home Health Care Services. You click that, then you can put in whatever location you want to. I'll use what TCAD zip code is. There, let me try to find one that's got.
We're not seeing your screen.
Oh, you cannot see my screen. Okay, I'm sorry, everybody. Could you see the workbook when I was doing that?
No.
Okay, hang on.
You still got your presentation up.
Let me do this then. I apologize, everybody.
There we
Can
go.
everyone see this? Yes.
Yes.
Okay, this is what I was trying to show everybody earlier, is the home health care booklet that I sent out yesterday along with the presentation. You can see that this booklet has who's eligible, what service are covered, how to find and compare, and I'll go over find and compare again. Your Medicare right, and I'm not going to go through it like I said, but you can see in the table of contents, you can find all these specific topics and go through there and find all that information yourself. I sent that out along with the presentation yesterday. I do encourage everybody to save that onto your computers or to get a copy of that and keep that just for good record. Home health care doesn't come up a ton, at least in my experience with the program, but I find that it's always really good to have something on hand to refer to when you do get those specific questions, and to be able to, help people as much as possible. Yeah, and if you need one, you can always reach out to myself or Lonnie. I know that we've got a bunch of these booklets up at TCAD, and I'm sure that we'll get this year's or the most recent one pretty soon here. Okay. I'm going to make sure that I'm sharing the right thing. So here we go. I'm going to share this. Okay, everybody can see this now, correct?
Yes.
All right, perfect. So anyway, if you go to medicare.gov, you'll see, you know, these people in their jackets. That picture may be different, like I was saying before. All of this information seems to change fairly regularly in how it's laid out, and sometimes this is on this side, sometimes that's on this side, while CMS has been working on these websites pretty quickly here. If you go right below these people and click Find Care, click right there, and then it'll take you to this page, and you'll see Home Health Care Services right here. It's a house with a heart in it on top of a hand. If you click that, I'm not going to do a zip code. I'm just going to do Tennessee. Click go. And it's showing 3 home health agencies that serve Tennessee. But there's actually more. It's got 129 results in there. You can go and do comparisons. If you want to search for by zip code or by a specific agency, you can choose up to 3 to do the comparison. Okay. There's 129 results, but you can choose up to 3 to do the comparison. Thank you, Linda. You can search by agency name. You can filter by who has a high star rating, anything, patient survey summary ratings, anything like that. You can go through and do your comparison to help find a home health agency right here. You can find that right on Medicare.gov. Again, you go to Medicare.gov, go down and find care, search your zip code, the state, whatever the name of the agency is, whatever that may be, and you can do a comparison to find the home health agencies that would suit that person's needs the best. So I'm going to stop sharing this right here. Okay, did we have any more questions, Lonnie?
No, I do not see any more questions.
Okay. Well, I'm going to go ahead and stop the recording.